Hey everybody, Dr. Toe here, physical therapist. This video is not meant to diagnose or treat. It is meant to encourage people to exercise and move. I wanted to do this video because I felt like it was really important to communicate to people that if you are currently trying to get over or currently sick with a upper respiratory virus or bacterial infection, pneumonia, anything that's going to involve a respiratory infection of the lungs, whether it's bacterial or viral, doesn't matter. One of the best things you can do for yourself is to move. This will help eliminate junk that is in your lungs and keep your lungs in the best health they can in the best situation or in this current situation that you might be in. So this is a third-part series or a third video to three-part video series. The first video series that I did was for supine exercises or bed exercises. The second one was sitting at the edge of bed exercises, and this video is going to be standing exercises at the edge of the bed. My goal is to get this video out to anybody who's in the hospital to help encourage them to know how to move and exercise. Most of these exercises you want to try to do as best you can 2 to 3 times a day as you feel you can, and as safely as you can. We're going to talk about how to do that in a minute. You need to stay within the safe limits while exercising. The other thing is you will most likely need supervision for this part of the exercises. You might need a walker, and if you're in the hospital, you can use a walker in front of you and the bed rail to the bed. If you're saying, hey, I don't have a walker, you can ask physical therapy or nursing to get a walker for you, or your case manager in the hospital to get a walker for you while you're in the hospital, if you need that in order to help you exercise. Okay, so things that you are also going to need. Obviously, most of the reason why I'm doing this video is for anybody who is on oxygen because of the respiratory issue that they're having. So I'm going to put oxygen on. Okay. The other thing that you should have is a pulse ox. It tells you the saturation of your oxygen in your blood. Very, very important. Whenever you exercise, you want to make sure that you're in the range between 90 and 100% saturation. Anything below that, so anything 89 and below, means you need to stop doing your exercises and you need to recover and breathe deeply, in through your nose, out through your mouth, until you recover back into that 90 to 100% saturation zone. Don't keep working. Make sure that you stop, recover, and once you've recovered and you feel ready, start exercising again. Another thing that you might do is you might turn up where your oxygen is at. If you're on 4 liters, you may need 6 liters while you're exercising, because you're increasing your demand, and so therefore you need more oxygen. And this will help you to get oxygen into your system. And that might also help to decrease the disruption in exercises. Okay, so here we go. We're going to start standing at the edge of the bed, right? And again, you might have a walker in front of you, and you also, if you're in the hospital, you most likely have a railing on the bed that you can put up and hold on to if you need to. Okay, first exercises, we're starting with the feet first, is our heel raises, and that's exactly what they sound like. You're just picking your heels up off the floor. Now again, you might need something to hold on to. I am obviously not doing that, but I could have a walker in front of me, or I could be turning sideways and hold on to the bed and the walker like this. Either way. Okay, 5 to 10 repetitions, no more. This is you have to figure out what your baseline is. If you're transitioning from sitting exercises into standing, and you were doing 30 while you were sitting, 30 repetitions for all your exercises, you need to bring them back down to 5 to 10 and see how well you tolerate. And then you can bump them up slowly as you exercise and figure out your tolerance level. All right, next exercise is the opposite, toe raises. Hey, Dr. Toe. No, they weren't named after me. So all you're doing is just picking your toes up off the floor. Nothing else is moving. Don't move your butt, okay? It's just your toes, and it's a really small movement, okay? 5 to 10 of those. Next movement is marching, okay? This is less intense than sticking with one side. Again, it takes some balance. This is where you need to be safe. You might need a nurse, loved one if you're not in the hospital, somebody to stand by and watch you exercise. Okay? This is more intense, less intense marching, 5 to 10. Next exercise, you're going to kick forward. And again, whatever you do on one side, you do on the other. 5 to 10. Next exercise, sideways. Keep your toes facing forward and make sure that you're not bending at the hip. It's just you, or bending at your torso. It's just your hip that's moving. Okay, both sides. Next one. Turn sideways and you're kicking backwards. Okay, 5 to 10. Make sure you're not hinging forward and backwards like, you know, I don't know, like a clock or something. Next exercise. Next exercise, you're gonna stay, I'm gonna stay sideways so you can see what I'm doing. And it's the opposite of marching. You're not bringing your knee forward. Your knee stays exactly where it is. And you're gonna pretend like you're kicking yourself in the butt. Both sides. 5 to 10. Okay? Next exercise. This one is a little more intense. So only move on to this one when you really feel ready. Basically, you're just doing sit to stands. Sit, stand. Okay, with this, you can use your hands to support. As you get better, you go to one hand or no hands. And when you do this, when you sit down and you come up, you want to squeeze that butt. Make sure you're safe. All right, and that is it for the standing exercises. I also encourage you, if you can get up and stand and you're going to the bathroom, I would tell you to start walking to and from the door. Again, you have to make sure that you're safe when you do it and that you have enough leash when you're walking in the room with your oxygen. If you don't have enough leash, you need to ask nurses to give you enough leash. This is a very easy thing to remedy. They can just add another tube, a couple of 5-foot tubes to the tube that you have on. Now you might have to turn up your O2 a little bit further because now your oxygen's having to go a little further to get to you while you're exercising, but then they can put you back on a short tube if you need to. So anyway, that is it. I hope those help you, and God bless you in your healing, and I really hope that you're progressing through and that you start feeling better soon. Bye everybody. Dr. Toe out.